Met Tim Atkinson in the emergency room. The emergency room doctor called me and explained that he had a patient that had one arm that was badly injured in a bike accident, broke his femur.
I was in the middle of a bicycle event called the Triple Bypass. Didn't notice that there were some pretty serious rumble strips, vertebrates in the road. Caught them diagonally, and it popped my one hand off the handlebars, and that's just not a great place to be. I kept moving, the bike stopped moving, and ended up on the pavement.
And the x-rays showed that he had badly fractured his femur, the top of his femur, and basically his fracture involved about 4 or 5 pieces at the top of his femur, and it was broken pretty badly. When you do surgery on bones, you can do surgery under real-time x-ray, and so essentially what we're trying to do is put a big titanium rod inside of a big bone, which is the femur. And so we use real-time x-ray, which is called fluoroscopy, to see where we are inside of the bone without actually seeing it with our eyes. And so you have to 3D position your the implants and the drills and the guides using imaging equipment instead of just looking at it like hands-on.
One of the reasons why this was a difficult decision for me is it involved one of my legs. And I've been an arm amputee for years and years, and I have really banked on the fact that I'm ambulatory, that I can run, that I can ski, that I can bike, that that part of me works extremely well, and would have a lot of trouble envisioning what life would be like if there was any impediment to doing the things that I've been doing and enjoying for the last 40 years.
Yeah, the fact that Tim is a longtime amputee did affect my treatment plan and the way I went about the patient, because the stakes are up. Of course, he has 3 good limbs, and so it's very important that obviously we preserve this. What stood out about Tim was the drive that he has. He was not an ordinary patient, meaning that he had unbelievable physical drive. He's a very accomplished attorney and has obviously a lot of mental drive, and has been through so much adversity in the past that this was just yet another sizable hurdle, and he just saw it that way and has tackled it as such.
When Dr. Joseph came in, he was calm. He was knowledgeable. I said, what does this look like? And he mapped out not only a surgical procedure and progression, but a rehabilitation methodology that just made perfect sense. I mean, it was obviously someone who had done this before and done it well, and had a great expectation that he could accomplish this successfully. He actually was able to provide everything that I was looking for in terms of what would give me a level of comfort.
We often are confronted with a patient that's, let's say, visiting here, where they don't have confidence that they're in a reliable facility because it's a small community. And basically, by explaining the amount of injuries and the amount of ski injuries, specifically with each injury, like his femur fracture, and explaining that yes, we've done 50 to 100 of these in the last couple of years, then that really gives patients a lot of comfort that they're in the right facility.
In 2 months since the accident has occurred, I've been able to go from a wheelchair to a crutch, to about 3 weeks ago, no crutch. Which means that I'm walking. I am now bicycling on a big boy bike with 2 wheels out on the road, and enjoying it at a level that I can't even relate.